Hey guys, what's up? Welcome back to my channel. My name is Katie. I'm a PA student in Charleston, South Carolina. I'm in my second year of school, so that means I'm on my clinical rotations. I have my golden retriever Bentley in the background. When I sat down to film, she said, "All right, Mom, I'm coming too." So anyways, she's here in the background, so don't mind her. But anyways, I wanted to film this video so you guys can see what's in my clinical bag and what I take with me on a daily basis to go to all of my different clinical sites. So just a little bit of background. I have completed 2 out of 9 clinical rotations, and I'm in Charleston for our callback week, and then I will be off to North Carolina for my next one. So my first one was here in Charleston in Mount Pleasant during Family Med, and then my last one was Women's Health in West Palm Beach, Florida, which was a total blast. It was so much fun to go somewhere else, but I am excited to be closer to home. I had a big learning curve trying to be there. So anyways, not really the point of the video, but just a little bit of background. So I am going to go ahead and get started, show you what's in my clinical bag, some things that I think are helpful, some things that are not so helpful, and honestly probably going to clean out my bag while I'm doing this because it kind of gets messy and jumbled after 5 weeks of go. So first off, I'm going to start by showing you what bag I use. So I just use this like Michael Kors version of the Neverfull. I've had this for a long time. I've used it for a bunch of other things. I always take it on airplanes with me, but it's just easy. It holds a lot of stuff, and it's what I had. So you don't need to go out and buy a new clinical bag. You can probably find something at your house. You can even use your book bag if you want to. I just didn't want to because I wanted to feel like I was going to work, not that I was going to school. So that's why I used this. And as you can see, I have a little claw clip on the side of it. I always have a claw clip on my book bag or this bag because you never know when you're gonna need something like that. So that's why I keep that there. But let's go ahead and get into it. So the first thing I always keep with me is my laptop, just regular MacBook Pro. I put all of my patient charts in there. So we have to document a certain number of patients for each rotation with my school. We have to put their age, what their chief complaint is, a little brief H&P, then the ICD-10 codes and the CPT codes for the visit that our provider used, or like what we think they should use, just so we can practice like getting used to charting on people, as well as it helps our program kind of track who's seeing what. It helps our program track like who's seeing how many patients in each rotation to evaluate if that's still a good rotation for our program. So the next thing is my iPad, and I honestly don't use my iPad as much in clinical as I did in didactic year, and that's just because I use this so much for note taking, and now I'm not really taking notes per se, and you can't really bring an iPad into a patient room. Like if I was a patient and somebody brought in their iPad to take notes, I would feel a little bit weird about that. I don't know why. We're all moving to a technology-based age, but so yeah, as I was saying, so I don't like to use my iPad in clinic as much. However, if I do need to reference my PowerPoints or something like that, I like to have it with me. And also, I've been doing Rosh questions on here, looking at UpToDate if I want to. I can do that on my laptop too. I use both kind of interchangeably, and I also have been recently using my iPad to edit videos. So, on my lunch break or whatever, if I have downtime, I can do that. I haven't really been doing that necessarily a ton, just because I wanted to make my study guides, which I'm going to do a whole nother video on how I study for the EOR exam. So stay tuned for that. You might see this one after that, actually. Anyways, hey, can you go this way? Go this way. Come on. She wants to be involved and look out the window and stuff. But anyways, okay, so another big thing I always like to have with me is the Big Daddy Pants Prep Pearls. I use both I mean, obviously it's broken into 2 books this time. I use version 4. It's just what was available during my didactic year, and you don't need to buy another one of these. You buy one for PA school and you're pretty much set. So that is kind of what I use to look things up quickly, to make my study guides, which, like I said, I'll make another video on how I study for the EORs. But if I have downtime during my day and all my patients are charted, I'm working on my study guide with these. So I really like those. Bentley, please go. Can you go? Can you go? Go get her. Go. So another good review book that a lot of people like is the PA rotation exam review, and I like this book, but I just haven't really used it a ton so far. I didn't use it for family med just because family med is a huge exam, and I didn't really have time to read it personally. And then the next one was women's health, which is something I'm pretty proficient in, so I don't know, I'm just using it as a reference, but it's a good one to have if you need to look things up, or if you like things more in like a chart or table base. This is a good book for you. Okay, so next in my bag, I have an extra study guide. This one printed weird and I just haven't thrown it away, but I do have like my actual one in this book. I made all of this and it's like 1,000,000 pages long, so I always have that so I can read, like I said, on my downtime. Another thing that I think is really useful is like a little notebook. So I just got this one from Walmart. It's like a little 5-star. And so when I was in family med in particular, I used this a lot, and I would put like the patient at the top of the page, like 27-year-old male. And then I would write down, you know, what they were telling me, what their symptoms were, you know, medications, things like that. And then I would be able to go use this to present to my preceptor, as well as use it to like chart notes. And then sometimes if my preceptor had other things they wanted me to ask, I could write those questions so I knew what to ask the next time I saw a patient with shortness of breath, runny nose, cough, you know, to make sure I asked those questions. Next thing, pens. Gotta have plenty of those, and I love colored pens. I got these at TJ Maxx, but I mean, you can use whatever you want to. Like, a pen is a pen, really. But I'm notorious for losing them, and I do like colored pens, so I went ahead and got these last time I saw them, and I just keep them in there so that I know where they are. I can grab one when I need it, and I'm good to go. Next thing in my clinical bag is my stethoscope. This is the Prestige Medical one, and it's like fine for your first stethoscope, but if you're like really including and like you are listening to a lot of hearts, and like, I mean, you should listen to everybody's heart and lungs, but what I'm saying is, like, if you have somebody who has like cardiac history or a murmur or things like that, it's gonna be a lot harder to hear on this than it is like a Littmann. So if you want to just go ahead and bite the bullet and get a Littmann, you can. This one was a gift to me, so I just got it because I'm broke and Littmanns are expensive. Next thing, a speculum. I was just in women's health, and so my preceptor wanted me to practice like the motion and like how to hold it, so she just gave me one of these, but obviously now I don't need it. A pack of gum. I always like to have gum on me just in case I, you know, get some stinky breath after lunch, whatever, and I don't have a toothbrush with me. Let's see. That's my flu vaccine information. I literally just got home from my women's health rotation actually yesterday, so I'm kind of like going through my purse to also unpack, so that's why there's some weird things in here. I have my Instax camera film in here. I also use this bag for a purse most of the time, so that's why those are in there. And I have my external hard drive for when I was editing on my computer. I just saved the videos to this so it doesn't take up a ton of space on my computer. And then I have like reusable footage in there, like my old intro and stuff, which I'm trying to make a new one, but I honestly, like, at this point I'm like, let me just make the video and focus on those types of things a little bit later. And then the rest of it in here is just like random pens, chapstick, always need that, hoop earrings. I just dropped one way over here. I don't know, just random things that are in my clinical bag. But the things I think you definitely should have are your stethoscope, and if you're in family med, an otoscope if you have one, a notebook, your review book, pens, your computer, iPad if you have those, just so that you can easily access up to date when your preceptor says, what do you want to do for this patient? So you can go ahead and look at it. If I didn't have my computer on rotations, I think I would have really struggled. Having the notebook is important because you want to be able to take as many notes as possible on your patient. If you don't have like an intake sheet or like a vital sheet and you don't have anything to write on, you're not going to be able to remember everything the patient tells you, especially earlier on in your rotations. So having that notebook is just so helpful. And like the smaller ones I think are better because you can fit it in your white coat pocket if you wear your white coat on rotations. I haven't really worn mine, but a lot of people in my program have. So it just really depends on your preceptor, but definitely get a notebook. Definitely have plenty of pens to write with because preceptors will take your pens. So if you don't want them to take all your colored pens, maybe get some, more bland ones. Stethoscope, you want to listen to heart and lungs on every single patient that you go to. And then whatever you need to study. So, for me, I have had downtime to study in most of my clinic days so far. I'm going on to rotation 3, so we'll see how that goes. But that is what's in my clinical bag. I like this bag a lot. However, there's plenty on Amazon that you can find. I'm actually going to link my friend Alyssa's storefront. She's also in PA school, and I have a storefront too, but she's already got hers set up for PA school. She has a whole section on there. It's got clinical stuff. It's got the Pants Prep Pearls. It's got the PA exam review guide. It's got a clinical bag that she uses that's really cute and it has more compartments. So I would recommend that one probably more than this one. But like I said, you don't have to go buy a new bag if you don't want to. And that's just it. So thank you guys so much for watching this video. If you want any more information on the products that I use during PA school, please feel free to comment down below or send me a message on Instagram. I reply to every single message and I will do my best to help you. If you are a pre-PA student looking for PA school advice, I do Zoom calls for that. So you can go ahead and send me an email, which I believe is in my description. If it's not, it's in my Instagram bio. Or you can comment down below. I will see whatever it is that you send me or comment. So if you need help with PA school, I'm happy to help. I wish I had someone that would do that for me, and I want to be a resource to you guys. So whatever you guys need, comment down below. I'll make a video about it.